Good day, ma'am. We are the Group 9 and today we are going to report the corticosteroids. So what is corticosteroids? Corticosteroids are hormones secreted by the adrenal cortex of the adrenal gland. It is commonly referred to as steroids. Corticosteroids are a type of anti-inflammatory drug. Corticosteroids are divided into two categories based on the structure and biological activity, and this will be tackled later on in our video presentation. Disease concern of corticosteroids. Corticosteroids are mainly used to reduce inflammation and suppress the immune system. They are used to treat conditions like asthma, allergic rhinitis and high fever, urticaria or hives, atopic eczema, chronic obstructive pulmonary disease, inflammatory bowel disease including Crohn's disease, and ulcerative colitis. Next is the nursing process for corticosteroids therapy. First is the assessment. Minimum assessment data for patients receiving corticosteroids include baseline weights, blood pressure, and electrolyte studies. Monitoring of all aspects of intake, output, diet, electrolyte balance, and state of hydration is important to the long-term success of corticosteroids therapy. Next is history. In taking the history, you should ask the patient the following questions. First, ask the patient to describe the current problems that initiated this visit or admission. Second, how long have the symptoms been present? Third, is this a recurrent problem? If so, how was it treated in the past? And lastly, determine when the patient was last tested for tuberculosis if an infectious process is suspected. Next is the history of pain experience. See the nursing process for pain management in Chapter 18, page 242. Next is the medication history. Obtain a detailed history of all prescribed and over-the-counter medications. Ask if the patient understands why each is being taken. Ask specifically whether corticosteroids have been taken within the past year and for what purpose, and tactfully determine if the prescribed medications are being taken regularly, and if not, why not. Next is the central nervous system. First is the mental status. Patients receiving high doses of corticosteroids are susceptible to psychotic behavioral changes. The most susceptible patients are those with previous histories of mental dysfunction. Perform a baseline assessment of the patient's ability to respond rationally to the environment and the diagnosis of the underlying disease. Check for the orientation to date, time and place, and assess for level of confusion, restlessness, and immutability. Make regularly scheduled mental evaluations and compare the findings. Next is the anxiety. What degree of apprehension is present? Are there stressful events that precipitated the anxiety? Next is history of ulcers. Patients receiving corticosteroid therapy have higher incidences of peptic ulcer disease. Ask the patient about any previous treatment for an ulcer, heartburn, or stomach pain. Periodic testing of stools for occult blood may be ordered. Next is the physical assessment. First is the blood pressure. Obtain a baseline blood pressure reading in both the supine and sitting position. Because patients receiving corticosteroids accumulate fluid and gain weight, hypertension may be developed. Next is the temperature. Record daily and monitor more frequently if elevated. patients receiving corticosteroids are more susceptible to infection, and fever is often an early indicator of an infection. Next is the weight and for distribution. Obtain the patient's weight on admission and use as a baseline in assessing the therapy. Because patients receiving corticosteroids have a tendency to accumulate fluid and gain weight, the daily weights are an important tool in assessing ongoing therapy. Observe for any changes in the distribution of fat and for any muscle weakness or muscle wasting. Next is the pulse. Record the rate, quality, and rhythm of the pulse. Next is heart and lung sound. Nurses with advanced skills can perform auscultation and percussion to note changes in the heart site and heart and lung sounds. Next is the skin color. Note the color of the skin, mucous membranes, tongue, earlobes, and nail beds. Lastly is the neck view. Record any jugular vein distension. This may be an indication of the fluid overload. Next is the status of hydration of the patient. Dehydration. Assess and record significant signs of dehydration in the patient. Next is the skin turgor. Check skin turgor by gently pinching the skin together over the sternum, forehead, or in the forearm. Next is the oral mucous membranes. When adequately hydrated, the membranes of the mouth feel smooth and glisten. In dehydrated patient, they are sticky and appear dull. Next is the laboratory changes. The values of the hematocrit, hemoglobin, blood urea nitrogen, and electrolytes will appear to fluctuate based on the state of hydration. Next is overhydration. Increase in abdominal girth and circumference of the medial malleolus, weight gain, and neck vein engorgement are indication of overhydration. Next is the edema. Is edema present? It may be an indicator of fluid and electrolyte imbalance. Next is the laboratory test. Patients taking corticosteroids are particularly susceptible to the development of electrolyte imbalance. Patients most likely to develop electrolyte disturbances are those who, first, in addition to receiving corticosteroids, have histories of renal or cardiac disease, hormonal disorders, massive trauma or burns, or are in diuretic therapy. Review laboratory tests and report abnormal results to the physician promptly. Because the symptoms of most electrolyte imbalances are similar, the nurse should assess changes in the patient's mental status. Next is the nutrition. Obtain a history of the patient's diet. Ask questions regarding appetite and the presence of nausea and vomiting. Anorexia, nausea, and vomiting are early indications of corticosteroid insufficiency. Next is hyperglycemia. Corticosteroid therapy may induce hyperglycemia, particularly in pre-diabetic or diabetic patients. Activity experiences or activity. Next is activity and exercises. Ask questions to obtain information about the effect of exercise on the patient's functioning. Is the person normally sedentary, moderately active, or very active? Has there been a reduction in activity level to cope with associated fatigue or dyspnea? Are the activities of daily living being performed by the person? Next is the nursing diagnosis. First, activity intolerance. It is an indication. Next is fluid volume excess. It is an indication. Next is pain, acute or chronic. It is also an indication. Next is tissue perfusion altered. It is also an indication. And lastly, injury risk for. It is a side effects. Next is the planning. History of illness. If an infectious process is suspected and tuberculosis testing is planned, it should be performed before initiation of corticosteroid therapy. Next is medication history. Review medications being taken and establish whether they are being taken correctly. Next is medication administration. Glucocorticoids may cause hyperglycemia, necessitating the monitoring of blood glucose levels and appropriate intervals. Next, during steroid replacement therapy, the administration schedule for the replacement drugs should mimic the body's normal circadian rhythm. Next is steroid replacement therapy is gradually discontinued in small increments to ensure that the patient's adrenal glands are able to start steroids appropriately as the drug doses is reduced. Next is the planning. Medication administration. Glucocorticoids may cause hyperglycemia, necessitating the monitoring of blood glucose levels at appropriate intervals. During steroid replacement therapy, the administration schedule for the replacement drugs should mimic the body's normal circadian rhythm. Steroid replacement therapy is gradually discontinued in small increments to ensure that the patient's adrenal glands are able to start steroids appropriately as the drug dosage is reduced. Next is the central nervous system. Plan for stress reduction, education and discussion of effective means of coping the stressful events. Next is fluid volume status. Plan to monitor intake and output at intervals appropriate to the patient's condition. Report intake that exceeds output. Next is nutritional history. Examine the dietary history to establish whether a referral to a nutritionist would benefit the individual's understanding of the diet regimen. Next is laboratory test. Order stat and subsequent laboratory studies. Next is implementation. First, medications. Order medications prescribed and schedule these on the MAR. Next is pain management. When pain is present, comfort measures must be implemented to allow the patient to decrease the pain. Deal calmly with an anxious patient. Next is vital signs and status of hydration. Monitor vital signs and perform focused assessment of heart, respiratory, and hydration status at specified intervals. Perform daily weights using the same scale in clothing of approximately the same weight at the same time, usually before breakfast. When fluid restrictions are prescribed, 1/2 of fluids is generally given with meals. Next is the nutrition. Schedule meetings with a nutritionist to learn how to manage specific dietary modification prescribed. Next is laboratory studies. Check for and report abnormal laboratory values. So these are the example of the corticosteroids preparation and the patient education and monitoring forms.
Patient education and health promotion. First, contact with physician's office. Assist the patient's understanding of symptoms that indicate consultation with the doctor. To improve healthcare outcomes, physicians must need more time with patients. The teaching physician's interaction with the patients must be enthusiastic, motivated, and responsive to individual patients' needs. The next one is skincare. Teach appropriate skincare and need to change position at least 2 hours, especially when edema is present. Skincare. Care of skin is important of overall care of a sick patient. The skin is the largest organ of the body. It is the immune system's first line of defense against infection. Coping with stress, patients receiving high doses of corticosteroids do